My name's Charlotte Mitchell. I'm parenting lead for Bolton Council, and I also have responsibility for managing the positive parenting team. Parenting works across a number of areas in Bolton. We work in partnership with a number of agencies as well. We work closely in partnership with the CAMHS support agency at the hospital and deliver parenting groups in conjunction with the team there. With regards to the level of service that we provide, we offer interventions at a number of stages. We offer universal interventions where we would offer information to parents, so we may deliver a seminar in a school, we may offer information sessions at various community points. We also offer brief information through schools and through the community where we would give a parent tips on basic parenting problems, so it may be something such as truancy, smoking, aggression, and the parent could receive a brief informative kind of session with the worker. At a higher level, we work in partnership with a number of agencies. We work closely with the police, with social care, with the hospital, with agencies stemming across every agenda really, where we deliver parenting groups which are more targeted and are for parents where they may be struggling with a number of problems with their child. The age range that we work across is from 5 up to the age of 16. We have a separate programme for primary age and a separate one for secondary age because parents often want to be in a group with people that are suffering from similar problems to themselves. Positive parenting is an intervention that's used with the families to try and improve the parents' parenting skills, and sometimes it can be quite daunting for a parent to access parenting support, and sometimes professionals feel that they may be intruding a little if they refer a family onto parenting support. It may be seen in the wrong way. But what we've found is that parents who access parenting support are far more positive with the children after an intervention, that the work that you may be doing with the child can be complemented by the work that we do with a parent, and that we should always consider it. And sometimes parents will surprise you in that they'll access it when you might think that they won't. Some examples of the work that we've done have included success in partnership with schools where a child may be struggling in their educational environment. We'll support the parent in supporting the child and engaging with the school. We work in partnership with social care where a child may be at risk of family breakdown, where the child is ringing up social work saying, we want the child to be accommodated. We will work with the parents so they see the child in a better light. Our service is quite unique in that we work for outcomes. We work with the family until we can see some changes with that family. We accept referrals from a variety of sources stemming across different agencies across Bolton. There isn't an agency that can't refer to us. However, we're quite unique in the fact that we do accept referrals directly from the parent. We wouldn't work with the parent unless there was a need identified, and we would undertake a number of clinical assessments with that parent to see if they met our criteria. The criteria they would need to reach: they would need to have a child that's illustrating behavioural difficulties. They would need to show us that the parenting may be struggling at the moment and that they may need to change some things with regards to the parenting. And they may be struggling with their own mental health, so they may be feeling a bit depressed, a bit low, a bit stressed, a bit anxious at times. But until we do that assessment, we can't necessarily see what that parent is going through. And it's really good in the fact that we do that before our intervention with the parent and we do that after the intervention. So we've got long-standing outcomes in Bolton and statistical evidence to provide us that prove to us that we are doing a good job. And on average, the parent and the child will improve after the intervention. With regards to making referrals to other agencies, largely we can solve problems for the parent and we can make things better, but when a parent or a child may need additional support, we would refer on to a variety of agencies across Bolton. At a lower level, these may be voluntary support agencies, and there may be support at school, there may be activities that the child can start to participate in, and at a higher level this may be a referral to social care if the child is felt to be at risk of harm, or a referral for the parent to the community mental health team if they're struggling with their own mental health. The referrals that we pass on are really variable. However, as I just mentioned, we do try to eliminate problems for the parent by giving them the skills to manage their own situation.